getting questions about COVID-19 answered by infectious disease doctors around Boston. And tonight, we're joined by Dr. Shira Doron, hospital epidemiologist at Tufts Medical Center. Thank you for being with us. This afternoon, the governor said cases, deaths are still on the rise. He thinks we're still on an upward trend. Right now, we're entering that expected surge. Can you tell us about changes you are seeing in the number of people seeking treatment?
Here at Tufts Medical Center, we are seeing a slow but steady increase in the number of patients coming in with COVID-19. We still have beds available, but we are preparing for that surge.
Can you talk a little bit about the symptoms that you're seeing? Do these patients seem to have more severe symptoms than we've seen previously, or is it about the same?
No, we're still really seeing a mix of mild, moderate, and severe disease. Those mild cases are ones that we send right home. The moderate cases go to a regular medical floor, and then the severe ones do go to the intensive care unit. It's not uncommon for somebody who has moderate disease who goes to the regular medical floor to actually need to be transferred to intensive care after a few days because people do progress from one stage to another.
Okay, what about the situation at Tufts when it comes to PPE supplies? You said you have enough beds right now. What about ventilators?
Yeah, so we're still exploring all avenues to increase our supply of ventilators and, of course, of personal protective equipment. Since we have no idea how many patients we'll ultimately get and how big this surge will be, we just continue to prepare as much as we can and to acquire anything we can get our hands on.
So we have been hearing about antibody tests, and today Dr. Fauci said we would have a large number of antibody tests available within a week or so. Can you tell us, why are these kinds of tests important, and do they have any limitations?
Yeah, I'm really excited about antibody tests, not as a diagnostic tool. It's really not going to be that helpful in figuring out who has COVID-19 now. What it tells you is who has had COVID-19, and that will include patients that may have not had any symptoms or had mild symptoms, who it never even occurred to them that they might have the disease. And so if we can get a better picture of how many people out there, what percentage of people in our country have had it and are perhaps at least somewhat immune to it, because we don't know to what extent those antibodies will confer full immunity, meaning you can never get it again, but they probably confer some immunity. That tells us a lot of things. It tells us more than we knew before about what the death rate is. So if you know the number of people that have had it, then you can calculate the true death rate. It also tells us how close we are to the possibility of herd immunity. When you have herd immunity, and usually that's around, for this virus, probably 50 to 60% of the population being immune, it tells us that we're going to be on the downslope in terms of the ability of the virus to keep being transmitted between people, because every time the virus bumps up against someone that's immune, it's not going to infect that person, and then it's not going to infect additional people. So it'll really allow us to do some better modeling around when we can end things like the social distancing measures.
Could be really promising, something to watch. Thank you so much, Dr. Shira Doron, Tufts Medical Center.